Chris Wier, nurse practitioner. Been in Lawson, grew up here actually. Been working here for about the last 6 years. Been involved with Excelsior Springs Hospital since 2010. I came up to Lawson and we had this small, I call it a house. It was about 3 little bedrooms, and I started there. I worked by myself, and I had one nurse, one reception there. And then just over some time, COVID brought on a lot of these things where this facility opened up in downtown Lawson. We looked at it. It was a doctor's building, needed to be renovated pretty bad. And the hospital stepped in, and then we renovated this new place. Been here for 2 years, and it's a state-of-the-art facility. We're not going to change the way we do things. Just because we're in some new great big facility, we're still going to have that hometown feel and take care of the people in the community. When I started in practice, I remember a physician I was following, he said a lot of people are going to have the next town syndrome, meaning the town that they live in doesn't really have the facility they need. They always got to go to the next town. But I think we're proving people wrong with that. They're coming in and seeing what we have to offer, and seeing, we have people here that are highly trained, and they went to the same school that some of those other facilities have as well. Being involved with Excelsior Springs, we have lots of capabilities here. We draw labs right here, so a lot of people are like, where do I need to go for labs? They can do the labs right here. We have an x-ray machine in here. We can do capabilities like that. I'm DOT certified, so if to drive an 18-wheeler, to drive a bus, whatever the case might be, there's not a lot of people around. There's nobody in Excelsior, nobody in Kearney, things like that. So I have that capability to do here. So that we get a lot of people from out of town even that come. So we got 2 front office ladies. When you come in, they're going to introduce themselves and welcome you in. We've got 2 nurses. They're actually LPNs, so a lot of office staff you'll see in a clinic or medical assistants, which do a great job as well, but these ladies are actually certified nurses. And then we have 2 nurse practitioners that work here. We have some physicians that come throughout the week as well.
I'm Amanda Stubbs, and I am Chris Wier's nurse. I've been here about a year and a half. I've been a nurse for about 30 years. Chris is just such a kind, good man, and his patients love him, and just the team. We're a good team. We all get along good.
My name is Laura Grigsby. I am the Rural Health Clinic Nurse Specialist here at Lawson Primary Care. I have been here since day one, beginning of the opening. I mean, we are such a small little tight knit. We know each other's families, each other's kiddos. It is. I love coming to work. So when you call this office, you know that you're not going to get a recording. You're going to get myself. I am going to be answering, I'm going to be talking, and I will return your calls. When our patients come in, we truly care. It's not just, why are you here? Why are you being seen? We want to know how the family's doing. And a lot of times when we're visiting with our patients like that, we get a lot more information too on how to provide better care. The amount of specialty groups that we are bringing in, why would we have to travel to North Kansas City or St. Luke's or some of these areas when we have these specialists who are coming right here to us, sometimes weekly, bi-weekly, every month, and we can offer that here. I think we've really stepped up our game.
We're very driven into the community here. We're up at the high school doing free sports clinics. We're out at the baseball field, myself coaching. We got a huge banner out there that we've given money to the local sports and things like that. So Lawson Picnic here, we're involved with them. So we want to be involved in the community, not just here to see a number of a patient, collect their finances, but also to help out.